rewiring our brains to overcome depression. I was skeptical at first, but also intrigued. So we're going to dive into some research today and see what we can learn. Our deep dive today is on a dissertation, and it explores something pretty interesting: the potential of theta brainwaves as a drug-free treatment for depression. Pretty wild, huh?
Yeah.
We'll be looking at some pretty mind-bending concepts like quantum medicine and this really intriguing device
Yeah.
called the Theta Chamber.
Hmm.
What I find really compelling about this research is that it's not just about managing symptoms.
Right.
It's about maybe even addressing the root causes of depression.
Totally.
Yeah.
What I find really compelling about this research is that it's not just about managing symptoms, but it's about going deeper and really
Yeah.
potentially addressing the root causes of depression.
Yeah, and it seems like this dissertation introduces a whole new paradigm
Right.
called creative integrative quantum medicine. It's a holistic approach that views us as more than just physical beings, right?
Exactly.
Yeah.
It suggests that we actually have 5 bodies of consciousness, not just one.
5 bodies.
Yeah.
Okay, I'm hooked. Can we break those down a bit?
Sure.
How does understanding each one help us understand depression?
For example, the dissertation suggests that blocked energy in the vital body, which governs our life force and energy levels, can contribute to feelings of fatigue and hopelessness.
Yeah.
Those are pretty common symptoms of depression, right?
Right.
So by learning to clear and revitalize this energy body, you might experience a boost in energy and motivation.
That makes a lot of sense. So where do theta brainwaves fit into all of this? I know they're associated with meditation, but what exactly are they?
Think of brainwaves like electrical signals produced by your brain, reflecting different states of consciousness.
Okay.
When you're in deep sleep, your brain is producing delta waves.
Mm.
When you're focused and alert, it's beta waves.
Mm-hmm.
Alpha waves are associated with relaxation, and gamma waves with higher cognitive processing. But theta is where it gets interesting.
Why is that? What makes theta so special?
Theta waves, which occur at a frequency of 4-8 hertz, are associated with deep meditation and enhanced creativity. But here's the really intriguing part. Theta waves give you access to your subconscious mind.
Whoa.
That's where many of your deeply ingrained beliefs and automatic responses reside,
Oh, wow.
often formed from childhood experiences.
Okay.
By accessing this level, you could potentially identify and rewrite those patterns that contribute to negative thinking and depressed mood.
Okay, that's starting to make sense. So if theta waves are the key to rewiring those patterns, how do we actually get into that state?
There are a few ways to induce theta brainwaves. Meditation is one, and binaural beats are another. And then there's the Theta Chamber used in this research.
A theta chamber. This sounds like something straight out of a sci-fi movie.
It might sound futuristic, but it uses a combination of techniques to induce the theta state.
Okay.
Imagine gentle spinning, like a rocking chair, combined with low-intensity electrical stimulation that helps regulate neurotransmitters. Then there are these trippy binaural audio beats, synchronized with flickering lights that further enhance theta brainwave induction.
Wow, that's a lot going on. But before we get lost in the technology, I'm curious about the results. Did this theta chamber actually help people overcome depression?
The dissertation presents 11 case studies, and the findings are certainly promising. For instance, one participant who had struggled with chronic depression for years experienced a major shift during a visualization exercise in the chamber.
Wow.
She was able to tap into a deep sense of inner strength, which she described as her invincible core. This experience highlights the potential of the theta state to access inner resources and cultivate resilience.
That's pretty incredible. But I'm already wondering, can you achieve the same results without this specialized chamber?
That's a great question, and it's something we can explore further. But before we do, let's zoom out a bit and understand why traditional approaches to depression sometimes fall short.
That makes sense. Let's talk about the elephant in the room. Depression is a huge issue affecting millions of people. And traditional treatments like therapy and medication, while helpful for some, don't always work for everyone.
Absolutely. And they can come with their own set of challenges, like cost, time commitment, and potential side effects.
Right.
So it's understandable why people are looking for alternative approaches.
Okay, so we've established the need for new approaches, and we've gotten a glimpse into the potential of theta brainwaves. But before we jump into alternative ways to induce this state, I want to touch on this whole quantum medicine thing. What exactly is it, and how does it relate to depression?
Quantum medicine is a fascinating field that challenges our classical understanding of reality.
Okay.
It introduces concepts like non-locality, entanglement, and the idea that consciousness plays a role in shaping our reality.
Okay, that sounds pretty mind-blowing.
Right.
But how do these concepts translate to a practical understanding of something like depression?
We'll take the concept of entanglement. It suggests that everything is interconnected, even at a subatomic level.
Wow.
Now, apply that to the 5 bodies of consciousness we discussed earlier. Imagine them as interconnected energy systems, all influencing each other.
Okay.
Disruptions in one body, like blocked energy in the vital body, can create imbalances in the others, potentially contributing to depression.
So instead of just looking at the brain, quantum medicine suggests we need to consider the whole system.
That's precisely.
Yeah.
It's about understanding how our thoughts,
Mhm.
emotions, energy,
Mhm.
and even our environment all interact to influence our overall well-being.
This is definitely a different way of looking at things. So if quantum medicine encourages this holistic approach, where does the theta state fit into the picture?
This is where it gets really exciting. If consciousness plays a role in shaping our reality, as quantum physics suggests, then accessing the theta state could be a way to tap into that power
Oh, wow.
and influence our internal environment, potentially shifting those patterns that contribute to depression.
So the theta state could be a bridge between our conscious mind and the quantum field, allowing us to rewire those deep-seated patterns that traditional methods might not reach.
Exactly.
Yeah.
And that brings us back to your earlier question. If we don't have a theta chamber, are there other ways to access this powerful state?
Yes. Let's move on to that. Tell me, what are some practical ways to tap into the theta state without needing high-tech equipment?
Well, meditation is a time-tested method, but there are other, perhaps less-known methods that we can dive into. One method that comes to mind is biofeedback. It's a technique that gives you real-time feedback on your physiological processes, including brainwave activity.
So instead of just trying to meditate blindly, you can actually see what's happening in your brain and learn to control it.
That's the idea. With neurofeedback, a type of biofeedback that focuses on brainwave activity, you can see those theta waves popping up on a screen and learn to enhance them through practice.
I can see how that would be helpful. It takes the guesswork out of meditation. Are there studies showing if neurofeedback is actually effective for depression?
There's a growing body of research suggesting that neurofeedback can be quite effective in treating a range of conditions, including depression, anxiety, and even ADHD. It's like learning to play a musical instrument. With practice, you can train your brain to produce the desired brainwave patterns.
Okay, so we have meditation and neurofeedback. What other tools are in the toolbox for accessing the theta state?
Well, remember those binaural beats we talked about earlier? The ones used in the Theta Chamber.
Yeah, those trippy sounds that supposedly sync your brainwaves.
Right. You can actually find binaural beat recordings online or through various apps. They're designed to induce specific brainwave states, including theta.
So if I want to tap into that theta state, I could just pop on some headphones and listen to a binaural beats track.
It's a surprisingly accessible way to experiment with brainwave entrainment. Of course, it might not be as powerful as a multi-sensory experience like the Theta Chamber, but it's certainly worth exploring.
That's pretty cool. You know, as we're talking about all these different techniques, I'm realizing that accessing the theta state isn't just about technology or specific practices. The dissertation also emphasizes the importance of our mindset and the environment we create for ourselves.
You're absolutely right. The researcher highlights the significance of setting clear intentions for healing, cultivating gratitude, and surrounding yourself with positive influences.
It makes sense. If we're trying to rewire our brains for positivity and well-being, it helps to have a supportive environment.
Think about it this way. If you're constantly bombarded with negativity, whether it's from news, social media, or even the people you spend time with, it's going to be that much harder to shift those deep-seated patterns.
It's like trying to grow a delicate flower in a harsh, barren landscape. It needs the right conditions to thrive.
Exactly. Creating a supportive environment for healing means cultivating positive relationships, engaging in activities that bring you joy and meaning, and practicing gratitude regularly.
Speaking of gratitude, the dissertation mentions its powerful effects on our brain chemistry.
It's not just about feeling good. Gratitude actually activates the reward center of the brain, releasing those feel-good neurotransmitters, dopamine and serotonin.
So those warm, fuzzy feelings we get when we appreciate the good things in life are actually backed by some serious neurochemistry.
Precisely. And studies have shown that people who regularly practice gratitude experience a whole range of benefits, including reduced stress, improved sleep, stronger relationships, and even fewer symptoms of depression.
That's pretty remarkable. It sounds like gratitude is a key ingredient in rewiring our brains for happiness. But let's be realistic. Even with all these tools and techniques, how long does it actually take to see real, lasting change? How long do you have to meditate or practice gratitude before those neural pathways start to shift?
That's the million-dollar question. And unfortunately, there's no one-size-fits-all answer. Everyone is different. And healing takes time. But what the research suggests is that consistency is key.
So it's not about having one amazing meditation session or writing in your gratitude journal once a month. It's about making these practices a regular part of your life.
Exactly. It's about creating new neural pathways, strengthening them over time,
Yeah.
until those new patterns of thought and behavior become more automatic.
It's like learning a new language or playing a musical instrument. It takes practice, patience, and a willingness to embrace the journey. The more you practice, the better you become.
And the more you cultivate those positive states of mind, the easier it becomes to access them, even when life throws you curveballs.
That brings us to another crucial aspect of healing: resilience. The ability to bounce back from adversity, to adapt and thrive in the face of challenges, is essential for lasting well-being. And from what I'm gathering, it sounds like resilience is a skill that can be developed.
Absolutely. The dissertation highlights the work of Dr. Aaron Antonovsky, who introduced the concept of salutogenesis. It's a shift in focus from what makes us sick to what makes us healthy.
So instead of just trying to fix what's broken, we're looking at the factors that promote well-being and resilience.
That's exactly. Antonovsky believed that a strong sense of coherence is key to resilience. It's the belief that the world is understandable,
Yeah.
manageable, and meaningful, even when things are tough.
It's like having a solid foundation that helps you weather the storms of life.
Precisely. And that sense of coherence can be cultivated through experiences of mastery, belonging, and meaning-making.
So it's about finding ways to challenge ourselves, connect with others, and find purpose in our lives, even in the midst of adversity.
And it's about recognizing that we're not alone in our struggles. We all face challenges. We all experience setbacks. But we also have the capacity to rise above them.
The dissertation also mentions Viktor Frankl, the Holocaust survivor who wrote Man's Search for Meaning. Didn't he say something about the power to choose our attitude?
Yes, Frankl believed that even in the most horrific circumstances, we always have the freedom to choose our attitude. He famously said, "Everything can be taken from a man but one thing. The last of the human freedoms, to choose one's attitude in any given set of circumstances, to choose one's own way."
That's a powerful reminder that even when we feel powerless, we still have the power to choose how we respond to life's challenges. And that choice, that act of choosing hope over despair, meaning over meaninglessness, is at the heart of resilience.
It's a perspective shift that can be incredibly empowering.
You know, all this talk about resilience and the power of our minds to influence our well-being brings us to a fascinating area of research: epigenetics.
Ah, yes. Epigenetics explores how our environment and our experiences can actually change the way our genes express themselves.
It's the idea that we're not just prisoners of our DNA. We have the power to influence our biology. I find that so hopeful.
It really is. The dissertation highlights the work of Dr. Bruce Lipton, a pioneer in the field of epigenetics. Lipton argues that our thoughts, beliefs,
Yeah.
and perceptions have a direct impact on our cellular function.
Wait, are you saying our cells are listening to our thoughts?
He suggests that our cells are constantly eavesdropping on our thoughts and responding accordingly. If we're constantly bombarding ourselves with negative thoughts and beliefs, our cells are going to reflect that. But if we cultivate positive thoughts and beliefs, our cells are going to respond in a more harmonious way.
Wow, that's pretty mind-boggling. So our minds are not just separate from our bodies, they're intimately connected and constantly influencing each other.
Precisely. And this has huge implications for healing. It means that we have more control over our health and well-being than we previously thought.
It's a paradigm shift, isn't it? From feeling like victims of our genes or our circumstances to realizing that we have the power to actively participate in our own healing.
It's a journey of empowerment. And speaking of empowerment, there's another researcher mentioned in the dissertation whose work aligns with this concept, Dr. Joe Dispenza. He's a chiropractor and researcher who has gained recognition for his work on the power of the mind to heal.
I've heard his name before. Doesn't he talk about the importance of creating a new mind?
Yes, he emphasizes the power of visualization, meditation, and elevated emotions in reprogramming our subconscious minds and ultimately shaping our physical reality.
It sounds like he's taking this idea of mind-body connection to a whole new level.
He's not just talking about theory either. Dispenza has documented cases of people who've used these techniques to heal from chronic illnesses, overcome addictions, and even transform their lives in remarkable ways.
It's inspiring to hear about people who have taken control of their health and well-being in such profound ways.
It's a reminder that we all have this innate capacity for healing and transformation. What we're seeing here is a convergence of ancient wisdom traditions, cutting-edge science, and the personal experiences of individuals who've tapped into the incredible healing power of the mind.
It's about recognizing that we're not just passive recipients of whatever life throws our way. We have the power to choose our thoughts, our beliefs, our attitudes, and ultimately to create a reality that aligns with our deepest desires for health and well-being.
It's a beautiful and empowering message.
It really is. But before we get carried away, there's one more fascinating concept we need to explore: the power of intention. We've touched on it a bit already. But the dissertation really emphasizes the importance of setting clear intentions for healing.
It's not just about wishful thinking. We're talking about a focused, conscious effort to direct our energy and attention towards a desired outcome.
The researcher talks about how healing intentions can influence our bodies at a cellular level, even affecting things like DNA expression.
It might sound incredible, but there's a growing body of research exploring the impact of intention on everything from plant growth to wound healing.
And it's not just about focusing on our own healing, right? The dissertation also highlights the power of directing healing intentions toward others.
Yes, there's this fascinating concept called remote healing. The idea that we can send healing energy to someone even if they're not physically present.
Is there any scientific evidence to support that? It sounds a bit like magic.
There are actually studies that have shown that prayer and other forms of distant healing can have measurable effects on the recipient's health and well-being.
It's a reminder that we're all connected, and that our thoughts and intentions have a ripple effect far beyond ourselves. It's both humbling and empowering.
I agree. It opens up a whole new realm of possibilities for healing and connection.
Okay, we've covered a lot of ground here. From theta brainwaves and quantum medicine to the power of intention and resilience, it's a lot to digest.
It is. It really is.
Yeah.
But I think the takeaway here, the most important takeaway, is that we have more power than we realize to influence our own healing and well-being.
Yeah. It's a message of hope and empowerment. And, as we've been talking and exploring all these different approaches, I keep coming back to this idea that healing is not a destination. It's a journey.
Absolutely. And it's a journey that's unique to each individual. There's no one-size-fits-all approach to healing. What works for one person might not work for another.
So it's about finding what resonates with you, what feels right for your body, mind, and spirit.
It's about being curious, exploring different options, and trusting your own inner guidance.
And it's about being patient with yourself.
Mm-hmm.
We've talked about this. Real lasting change takes time. It takes consistency. It's not about quick fixes or magic bullets. It's about those small daily choices that support your well-being.
It's about creating a life that nourishes your mind, body, and spirit.
And recognizing that setbacks are a natural part of the process. There will be times when you fall back into old patterns, when you feel discouraged, when you question whether it's all worth it.
But it's in those moments that resilience comes into play. It's about remembering that you have the strength to get back up.
Yeah.
Dust yourself off and keep moving forward.
And having compassion for yourself along the way. Healing is not about perfection. It's about progress. It's about embracing the journey with all its twists and turns.
And it's about celebrating those small victories along the way. Every step forward, no matter how small, is a step towards greater well-being.
This has been really incredible. This deep dive has been an incredible exploration into the power of the mind to heal. We've talked about it a lot. We delved into the fascinating world of theta brainwaves, quantum medicine, and the profound impact of our thoughts, beliefs, and intentions on our overall well-being.
And we've seen that while there's still much to discover, there are already powerful tools and techniques available to us that can help us tap into our innate healing potential.
It's been a truly inspiring conversation, but before we wrap up, I have one final question for you. What's one piece of advice you would give to someone who's struggling with depression and looking for a new approach to healing?
I would say be open to exploring new possibilities.
Yeah.
Don't be afraid to step outside of your comfort zone and try something different. Whether it's meditation, neurofeedback, energy healing, or any other approach that resonates with you, trust your intuition. Allow yourself to be guided towards what feels right. And remember, you're not alone on this journey. There are resources available. There are people who care, and there is hope.
That's a beautiful message to end on. Thank you so much for joining us on this deep dive. We'll catch you next time for another fascinating exploration into the mysteries of the mind, body, and spirit.